grown up in the area. I went off to medical school in London, but my first jobs after qualifying were in Southend. And I'd always had an interest in palliative care. In fact, when you do your medical elective as a student, you choose areas where you're interested in. I spent some time in St Francis Hospice in the last year of my training. And so in my early years as a junior doctor, I'd got in touch with the hospice, and at that time Michael Stewart, who was a local GP, was basically running the place single-handedly from a medical perspective, and I provided a bit of help and support. So I did some weekends on call, with him obviously as backup if there was a major problem, but it just meant that I got an early introduction into working in Fairhavens back in the 1980s. A lot of hospices were developed in the 80s. Every town was sort of saying, we need a hospice in our town. And what tended to happen is a group of people got together, really drove that process. So here it was Mike Stewart, Daphne Hall and Ian Coffey, and they were really the pioneers that got Fairhavens up and running. But it felt a bit like a little club, and the people you worked with when I started working here were incredibly passionate about caring for people, but they're also passionate about the organisation and even passionate about the building, because a lot of them had worked on painting the walls and getting the place ready to open and all that sort of stuff. So there was this sort of real sort of core enthusiastic group. So that's the sort of drive you need when you get something like that up and running, that sort of pioneer mentality, and that stood the hospice in good stead when it started up. My wife and I, when we moved down back into Essex, decided to foster. And because my wife's a nurse and I was a doctor, we were approached and said, well, would you be prepared to take children with complex health needs? Because that's a real problem. They require special support and care, and people need to be comfortable about managing tube feeding and various different sort of respiratory supports and that sort of thing. And so we started fostering children who had life-limiting illnesses, and the first two children we looked after, both who subsequently died from their diseases, needed a lot of care and attention. And we then became aware that families were needing to travel an awful long way to get any respite. So that made us start thinking about, well, there are these cohort of people in Essex area who could benefit from this, having that sort of facility, that sort of respite. And we discussed it as a leadership team in the hospice and put forward that actually perhaps this is something we could do. And that was part of the spark behind the Little Havens project, really. The team has responded brilliantly, and I think the thing that has made it even more surprising is that we didn't even have a chance to get bedded down, to work out where we kept equipment, to where we stored things, how we would organise things around the building. And then we were in lockdown and we had to deal with things at pace. We dealt with much more complexity. We had patients with COVID, with patients without COVID. We were running up more than our budgeted for capacity for a while to try and help manage the pressures on the whole of the health system locally, and it worked. And it's not down to one person. Everybody has to play their part to make that happen, because we had people off sick, we had people having to isolate, we had all sorts of tensions, but everybody did that extra mile to make it work well. And the focus has always been on trying to provide really, really good care. I think Fairhavens is hugely respected in the community because of its contribution. But I also know that without the community, for Havens wouldn't exist. And even during this last 18 months where the finances have been really hit because fundraising charity shops haven't been able to operate, events haven't been able to go on, people have stepped up and helped us, and there really is a real love for this organisation to thrive, and I think Havens as an organisation has responded to that and gives back to this community.